Hey guys, thanks for watching. Today we wanted to talk a little bit about chiropractic care and treatment, and we actually have my very good friend, Dr. Bryan Haas of, what is your name of your clinic now again?
It's Advanced Health Solutions.
Advanced Health Solutions in La Crescenta, Southern California, and Bryan has been treating me for literally almost 18 years. He rebuilt me back when I was a basketball player in my late 20s. All the way up until now, you know, with the fitness and stuff like that, he keeps us in great shape. And so what we wanted to do is we wanted to give him a little pub and exposure and let him, you know, kind of work on Monica and myself and let him talk about what he does. But we're very big proponents of chiropractic care and how important it is, you know, to structural integrity for people's spines and also just to feel good and feel better about yourself. I mean, chiropractic plays a huge role. So with that said, let Bryan.
Hello there, again, I'm Dr. Bryan Haas. We're going to adjust Monica here. Jay and Monica, like they said, I've been seeing them for quite some time now. When they come in, it's mostly just tune-ups for them. A lot of people come in with chronic conditions, or they're in a lot of lower back pain, neck pain, headaches, sciatica. They come in for maintenance and wellness and just preventative care. So their adjustments are pretty easy, they're pretty quick, they're tune-ups more or less. So like you get your car tuned up, we're going to tune them up. So let's start with Monica. When she came in, I just noticed there, one of the things we look at and assess is that the leg length is off, so her left leg is shortly off. Her left hip is higher on this side, so when I look down, you can see the left hip is elevated a little bit. We're going to adjust her left hip, and sometimes she gets the lower lumbar, which is shifted, which it is right here. Monica normally has a couple in her mid-back that's shifted here. People that do a lot of computer work, they're on the mouse, upper back, shoulders start to go forward, their head's forward, their posture starts to go after about an hour or so. So this is a common area to adjust with people that do a lot of chronic sitting, let's say. Monica, lay on your right side towards me. So we're going to adjust her hip first. This is what's diversified. This is kind of standard chiropractic adjustments using the hands. Some doctors use instruments, some people use their hands. I'm going to use my hand to adjust her hip. Like that. So that was her hip. And going to the other side, L5, which is rotated. We're going to adjust her L5.
Monica, tell us how you feel after you get adjusted.
Okay, good, like that. And we go right in there, bring this leg here forward. Okay, right in your back, gotcha. Okay, all in your back. Alright, so then after we adjust the lower back and hip, we always check to make sure the pelvis is lined up, the leg length's even, and it is. It's off maybe an eighth of an inch, so not too bad. So now we're going to adjust her upper back area. Monica, cross your arms here. Take a deep breath. Let it all the way out. Breathe. Breathe. Like that. So she had T6, T7, and T8 in her mid-back area. Now we're going to check her neck. Maybe we can come on over here. This is the one area that the general public is, you know, freaked out about, scared, they're nervous about getting their neck adjustment. You know, if a doctor knows what he's doing, he doesn't have to crank the head one way, crank the head the other way to adjust your neck. It's real simple, real subtle, really light adjustment. So she has C2 shifted here, C5 shifted on the left. So we just have her relax, and she's been adjusted by me, so she's already relaxed. So right in here, it's real subtle.
Yeah.
Like that. That's how simple it is. As you can see, there's just a slight rotation adjusting that area.
And that provides immense relief to people that have this, he was saying, like lordosis or stress from being hunched over at computer keyboards all day. For most people that are in like clerical administrative positions, that type of release right there is enormous. I mean, it feels so good. There's so much relaxation that sets in.
Absolutely. So now we're going to just C5, which is on the other side. Focus right here too.
Yeah.
It's as simple as that.
So you can just see, like Monica, just the physical reaction that she has.
Turn here, so we have a good range of motion like that. Let's have you sit all the way up. We sit all up, and how I conclude my adjustment is I always have the patient sit up. I then just do a quick check and make sure we got everything. So the neck, gut, mid-back, lower back, and when I go like that, that's my signature. We signed off on Monica.
Yeah.
She's all tuned up, ready to go.
Yeah.
How do you feel?
Awesome. Awesome.
All right,
my neck was bothering me. Feels good.
Great. All right. Ready? Yep. Hi, it's Dr. Haas again. Now we're adjusting Jay. This guy here, there's a reason why I work out. I'm about 210 pounds, and I got to move guys like this around who are very fit, obviously very muscular, and when certain areas of their body shift, it requires a little bit more energy, a little bit more force, let's say, to adjust someone like Jay. So if we look at Jay, his hip shifts on him too, and it's off just a hair right in here. When the hip shifts, one of the common muscles that goes into spasm is what's called the piriformis. When that piriformis is contracted, that muscle, the sciatic nerve, passes right through that muscle. It'll squeeze on that nerve, and that can cause sciatica all the way down the leg there. So for some people, it's not a disc problem, it's a piriformis syndrome it's called, and that's from the hip shifting out of alignment. He doesn't have that going down his leg, but we always make sure we tune him up and make sure he doesn't get that. Jay also gets, and he does have this today, he has a rib shifted right up in here on this left upper side. Again, people that work out, that sit a lot of computer work, those ribs can shift out of place here. So I'm going to adjust his hip first. Lay on your side, Jay, towards me. As you can see, I'm going to have to put a little bit more energy or a little more force to adjust a guy his size. So let's go right in here. Like that. Lie on your back. So that's the reason why I stay. How much you weigh now, Jay?
Right now I'm like about 215 to 218, but I've been eating
215, but
yeah.
Body fat 6%.
Yeah, less 6-7%.
Yeah. Deep breath right here, all the way out. Good. Go on your stomach again. Good. So when I adjust his rib, this is kind of a unique adjustment here. So his rib is shifted out up in this area. So I ask him to take a deep breath in, drop this arm down, let it fall, and just relax there, like that. So I just adjusted his ribs, first and second rib that were shifted there. You okay, Jay?
God, feels so good.
Jay gets these ribs shift, and he's like, it's a sharp pain. When you have a rib out, you take a deep breath, it's like a sharp shooting pain in your upper back. You feel like you're being stabbed in the back. Find your back.
Oh, it feels so much better. Jesus, dude. And that's been out probably for 2 weeks.
Well, yeah.
It's been a while.
Yeah, he's finally made it in. So we're going to check Jay's neck here now. Let's take a look.
Oh, God, dude, that feels so much better.
Good. All right, so Jay has a couple in his neck too. He's got one right here at C4. Same thing, it's real subtle, like that. Real quick, real subtle adjustment. And then C2 way at the top on this side. Drop here. Like that. Did that hurt, Jay? There's no pain. It shouldn't hurt. When we adjust the neck, there should be no pain involved when we do a cervical adjustment. So do not be afraid of the adjustment. If you don't want your neck to be cracked, we do, and I do have instruments that I can use to accomplish the same result via adjusting the spine without cracking the neck, let's say. Okay? And that cracking sound is just gas being released from the joint. So it's not your bones grinding together or anything crazy like that. Good, Jay. Sit all the way up, face the right.
Oh my God.
Again, both Jay and Monica, they're in good shape, as you can see and tell. So they come in for tune-ups. They come in for adjustments. Real subtle, real light. They come in for wellness, maintenance, and he's all set.
Just one other thing, I think a lot of people have a misconception or even a misnomer about chiropractic, that they feel like once they start seeing a chiropractor, it's like voodoo, or some mindset of like, I have to see them now once or twice a week, that once they start adjusting me, now I always have to get adjusted. Well, that's not true, and obviously, Dr. Haas can attest to that and talk in much greater depth than I do, but this is the first time I've been adjusted in over 2 months.
Right.
So regularly, it's better to come in, especially the harder the trainer you are. Like, let's say you do high-impact sports. Let's say you're a CrossFitter. Let's say you play basketball, or you do like volleyball, or you're a swimmer, or something that's high impact. Then it's much better to see a guy like Dr. Haas on a regular basis, whether that's twice a month, 4 times a month, 3 times a month, whatever. But when you need to, quite honestly, and Monica and I are very busy people, with just blog, and then of course our normal professional life selling real estate, and it's hard for us at times, also being parents, to get in at responsible times when we can. Obviously everybody's got their own flexible schedules, but we recommend that you see a chiropractor on a more regular basis than once every couple months. Especially for this, just for the rehabilitation of like staying in condition, make sure everything is properly aligned. Every other week, at least once a week probably is optimal.
Especially women that wear high heels a lot.
Right, and Jay's right, Monica's right. So everyone's different. Everyone's body's different. Everyone's lifestyle is different, right? So we all have different jobs, different occupations, and different amounts of stress. So some people, need an adjustment once a month. Some it's once a week. Some, like him, every 2 months, once a month or so. Just depends on your body, how well you take care of your body. what else are you doing to take care of yourself? Are you eating right? Are you stretching? You doing yoga? You working out? The more you can do on your own, the less adjustments you'll need. But yeah, tune-ups, this is what this is. It's a tune-up. No different than brushing your teeth, no different than going to the gym and exercising. So this is an adjunct to wellness and creating a healthy lifestyle.
Absolutely. So the only other thing I would want to say is we'll post on the blog, about his practice. Even if somebody, in this local area sees the blog or watches our blog and, wants to come and see Dr. Haas, we'll give you an incentive to do so. But this guy's an amazing doctor. Like I said, I've been coming to him for 18 years. And, whenever I have an issue about my personal health, I don't call an MD. I don't call anybody else. I call him because I know that, if he assesses my spinal health, there's a very good chance that I'm going to be, integral and whole as soon as he gets done with me. So
Dr. Haas is phenomenal.
Thank you for watching.
Thanks, guys.